Started when you're ready.
Well, good morning, everyone. My name is Yvette McVeigh. I am a benefits counselor with the Area Agency on Aging. Welcome to Medicare 101. So the majority of you guys hopefully are turning 65 or about to turn 65. And we just want to celebrate. Y'all making it to this moment, to 65. Welcome to Medicare 101 with Yvette. We're going to celebrate your turning 65 and get into Medicare. Come on. All right, just waking y'all up this morning. So, what is Medicare? Medicare is a federally funded program that offers health insurance to American citizens and other eligible individuals. The program is often called Original Medicare. It has two parts, parts A and B. Okay? Who can get Medicare? If you are a U.S. citizen or a legal resident that lived in the U.S. for at least 5 years in a row, including the 5 years just before applying for Medicare. You must also meet one of the following requirements. You must be 65 years or older, or you could be 65 years or younger with a disability, or any age with the diagnosis of end-stage renal failure or ASL, which is Lou Gehrig's disease. Okay. What does Medicare cover? Medicare covers parts A and B. Part A is inpatient hospital and skilled nursing. Part B covers doctor's visits and outpatient care. When can you choose a private plan to get more coverage? You have three options. You can be on traditional Medicare, which covers parts A and B. Medicare covers 80%, and you're responsible for 20%. Or you can get an Advantage plan, which is called Part C, which I call the bundle plan, that covers parts A, B, and D for your drugs. You can also get a supplemental plan, which we call Medigap, which allows you to be on traditional Medicare, which traditional Medicare, again, remember they pay 80% and you're responsible for 20%. And then the Medigap will cover the 20%, okay? What are your options? You can add coverage to the original Medicare or choose a Medicare Advantage plan instead, which we just discussed. So your options are traditional Medicare, which is plan A and B, and D, because you have to get a standalone drug plan, or you can get an Advantage plan, which bundles A, B, and D together, or you can remain on traditional Medicare and add a supplemental plan plus your drug plan. Okay. What does Medicare cost? Medicare has a premium fixed amount that you pay each month for the Part B premium, which right now it is $148.50. Unless you're in a higher bracket, then you may have to pay a higher premium cost. You may also share the cost for healthcare services you receive, which are your co-pays, your deductibles, and your co-insurances when you have an Advantage plan, or the 20% out of pocket for your traditional Medicare. So you may ask, what's a deductible? So a deductible is a set amount you pay out of pocket for covered services each year before Medicare or your plan begins to pay. So you may have a deductible of 20% or a deductible out-of-pocket max of like maybe $3,500 or $11,000 you have to pay. And then after you meet that deductible, your insurance will kick in and pay the rest. Your insurance will kick in and pay your out-of-pocket costs after you meet that out-of-pocket max deductible. A copay is a fixed amount you pay at the time you receive a covered service. For example, you may pay $20 when you visit the doctor or $12 when you fill a prescription. So most of us, if you worked and had your insurance through your employer, you had a copay if you went to the doctor, whether it was $5, $10, $25, or $30. You had to pay that copay, and that was your responsibility. And the rest, after you paid your copay, your insurance would cover the rest. What is coinsurance? Well, coinsurance is a percentage of the cost for a covered service that you may pay when you receive it. For example, you may pay 20% and Medicare or your plan will cover the rest. So you may pay 20% with Medicare because that's your coinsurance, and then Medicare will cover the 80%, which will equal the 100% of the cost of that visit or that procedure. Okay, when can you enroll? So when you're turning 65, people that turn 65, they have an initial enrollment period. It's a 7-month period of time that you can enroll for Medicare without facing any penalties. So if you're turning 65 this month, which is October, you have 3 months prior to October this month, and then you have to January to make those choices for Medicare without being penalized. So it'd be October, then November, December, January, and then the previous months, which would be July, August, September. So you have 7 months to during your initial enrollment period to make these decisions or choose your Medicare options without being penalized. Your initial enrollment period, it begins and ends 1 month earlier if your birthday is on the first of the month. It's also based on the 25th month of you receiving benefits if you become eligible for Medicare due to disability. So if I were to become disabled, I would have to wait 25 months before I'm actually eligible for Medicare. So for 2 years, I would not be insured by Medicare, but on 2 years and the 25th month, 2 years and 1 month, then I could apply for my Medicare, which would be my initial enrollment period. Now, if I'm under 65 at the time that I become disabled, once I turn 65, I have another initial enrollment period where I have a do-over to probably, if I was looking to get into a supplemental plan, that would be my time to get into it. Because when you're 65 and under, the supplemental plans, they're limited. They do offer them, but they are very expensive. You should be enrolled in Part A and Part B automatically at the age of 65 if you are receiving Social Security or railroad retirement benefits. Medicare will mail you your card at that time, okay? When can you change coverage? Well, it's coming up. Every year, October the 15th through December the 7th is what we call open enrollment. It allows you to go in and make changes to your current plans, update your medical or Part D plan. You can go from traditional Medicare to Advantage plan, from Advantage plan to traditional, or traditional to adding a supplement. This time, they allow you to make those changes if needed. If you're pleased with what you already have or the plans you have, you do not have to make any changes, okay? At the time doing open enrollment, take the time to review your coverage choices yearly, review your Medicare plans, review your benefits and the cost changes, because each year some things, change. Your out-of-pocket costs may go up. Your medications have changed during the year. I have a gentleman that calls me every year and say, hey, Vet, let's compare my prescription costs to see if I can save any money or if I'm spending too much out-of-pocket money. out of pocket. So this is the time for you to sit down and review all of those things to make sure you're getting the best bang for your buck, okay? You need to consider your healthcare needs and your budget for the coming year. You can keep the current coverage or change it as it's based on your needs, as I stated previously. So during open enrollment, which is October the 15th through December 7th, is coming up with Friday. This is an opportunity for you to look over your plans, review your options, look over your drug coverage to make sure your drugs are being covered. And if it's something you want to change or you want to see if you can make improvements somewhere, this is the time to do it during those dates, October the 15th through December the 7th. So what if I work past 65, which most people are doing? They're in good shape, they feel good. Some people will work to 67 because if they wait, they have more money, and you can do that. Social Security or Medicare will allow you to do that. So you still will have your initial enrollment period at the age of 65. You have to make Medicare decisions, even if you have employer's coverage through your employee insurance coverage through your employer. So if you decide to work past 65 and you have coverage through your employer's insurance, we always recommend that you take Part A because that's the free part. You worked, you put in those years, it's free. So you would just have double coverage when it comes to your hospitalization, right? You can remain to use your employer's insurance as long as it's a creditable insurance. So if somebody retires or not retire, but continue to work, or they're under COBRA, COBRA is not a creditable insurance. So you would need to get Medicare, go ahead and apply for your Medicare because COBRA is not creditable. So you would have penalties if you remain on COBRA, because COBRA can go up to 18 months. So for 18 months, if you're Medicare eligible and you didn't apply, you have 18 months worth of penalties, okay? So you wanna make sure the coverage that your employer has is creditable. Some employers require you to take full Medicare benefits at the age of 65. So you would want to get with your employer plan benefits administration before making those Medicare decisions. Be proactive. Make sure you know when your initial enrollment period date is. Medicare will notify you only if you're receiving Social Security and railroad benefits. You may need to sign up for Medicare yourself by contacting Social Security. So if you file for your Social Security, then they automatically will enroll you. If you decide I'm gonna wait till I'm 67 or 70 or whatever, then you will have to contact Social Security and let them know I'm going to apply for my Part A, and then I'm going to continue to work and I have a creditable insurance. Also, what I recommend doing too, if you decide to work past 65, is when you do decide to retire, to go ahead and get that slip or information that states that you had that coverage of a creditable insurance coverage while working. So that way, when you go to pick up your Part B, you already have that information because they're going to require it or request it, so they won't add those penalties to your Part B premiums, okay? So how do you choose the coverage for you, right? Think about your needs so you can see how different coverage options might work for you. You have to look at your health, your budget, and your preferences. How often do you go to the doctor? What health problems do you have? What medications do you take? Are you able to pay each month the monthly premium cost? Can you afford the co-pays, deductibles, and co-insurances? Are you willing to accept the high-risk out-of-pocket costs? Which doctors or hospitals do you refer? What pharmacy you would like to use? How important it is for you to have access to healthcare while traveling? What other coverage do you have, such as an employee or a retiree plan? Do you want vision and dental coverage? for those that travel abroad, like, if you have family and you go stay 6 months in Florida and 6 months in Texas, then you may want to get a supplemental plan. The Advantage plan won't cover that area if you stay there for 6 months. It will cover an emergency, but it won't cover if that's somewhere you reside for 6 months. So to enroll in original Medicare, like I said, it covers parts A and B, and you have to get a standalone drug plan. You have to get a drug plan, even though you're not taking drugs. If you don't get a drug plan, again, you will face penalties. We always recommend that if you don't take prescription drugs, to just go in and get the cheapest drug plan they have. And I think it's Silver Script, and it's right at like $7.50. So we also offer programs to help with cost. Medicaid has a program through Texas Health and Human Services has a program through Medicaid called the Medicare Savings Program. This program is Medicaid funded to help pay for the Part B premium costs of the $148.50. They have 3 different programs. It's based on your income and your resources. Also, Social Security offers a program called Low Income Subsidy or Extra Help that help with prescription costs. It is federally funded through Social Security. It takes them about 2 weeks to notify you if you have been approved or not. The Medicare Savings Program takes 45 days for them to process the application. Once the application has been completed, then they will notify you by mail if you qualify for the services. Both services are based on income and resources. One is just state funded and one is federally funded. And that's all I have at this time. We're opening the floor for questions.
Thank you. I do have a question, and I just wanted to clarify too. The cost assistance programs, you said that there are programs through Medicaid.
So yes, it's called Medicare Savings Program. It's Medicaid funded.
Okay.
So Medicaid funds that particular program.
Okay. And do you have to be a Medicaid recipient in order to access that?
No, but you have to be on Medicare.
Okay.
Because it covers the Part B premium.
Okay. And then you said that there is also cost assistance through Social Security. And could you identify which one is the federally funded one and which one is the state funded?
So federally funded is the low income subsidy extra help that helps with your prescriptions. State funded is the Medicare Savings Program, is funded through Medicaid.
Okay, perfect. Thank you.
No problem.
So we do have several questions. And I also know that a couple of people on here are asking about Medicaid. Can you explain the difference between Medicaid and Medicare? Sometimes those get a little confusing.
So what it is, when some people say, well, I want to apply for Medicaid. Traditional Medicaid, you cannot make no more than $771 or $73. It is not made for people that have worked and put in. Is basically for those that have not worked and not have access to insurance. I know it sounds weird. Although Medicaid have programs that are full Medicaid programs that are for Medicare recipients, for you to qualify for those programs, it's called Star Plus waiver. You have to have like some cognitive issues, or you have to be bedbound or need assistance. Let's see, trying to put it nicely.
Yeah, that one is a little tricky. I also have heard that it's to qualify also for the Star Plus program, an individual's medical expenses and needs sometimes exceed the income costs or the income that they currently receive.
Right. When you deal with Medicaid, everything you do that's state or federally funded is going to be income and resource based. So if you have a need, you've had a stroke or cancer or kidney failure, whatever, or dementia or Alzheimer's, you can apply for these programs through Star Plus. And they come out, they do their functional assessment, and then they submit it to your doctor. And once the doctors approve it, then the services start, and that's full Medicaid. That's as close as you're gonna get to Medicaid as a Medicare recipient.
And then I don't know if you mentioned this, so sorry if you did,
No problem.
but just to let everyone know that Medicaid is this state program, and Medicare is federal.
Right.
So you, if you are caring for someone or you are a Medicaid recipient and you move from the state that you are currently receiving Medicaid in, you need to reapply for Medicaid assistance in the new state that
Right.
you.
And make sure you cancel your current Medicaid in the current state. So if you live in Texas, you need to close out all your business here in Texas. And then when you get to Kansas or Florida, then you can reopen it up. Because if you leave it open in whatever state, then they're going to deny you because they're going to see it's open in the state you were in. So which is going to delay you from getting those services.
Does the Area Agency on Aging assist with Medicaid applications? Or have a referral process?
We assist with the Medicare Savings Program.
Okay.
If you want to apply for traditional Medicaid, then you need to go create your account with your Texas benefits and apply for it under that account.
Okay.
Now, when it comes to the Medicare Savings Program, we do assist with that because it's connected to Medicare.
Okay, thank you so
So
much.
if you're up under those, if you're within those income guidelines, then I can assist you with those applications.
Thank you. So let's see. Let's go to one of our questions is it better to sign up with Original Medicare and Medigap if you think you'll be moving out of Texas, or is it better to go with an Advantage plan? This individual would like some pros and cons. And I think you touched on that briefly about moving.
So if you travel a lot, it's not necessarily whether you're going to move out of Texas, it's the travel. So if you live in two different states, so when you get your Advantage plan, how they come up with your plan is in your covered area. Your covered area is determined by your zip code. So once you're out of that zip code, you're out of your covered area, if that helps. Mm-hmm. So if you travel a lot, then you may want to look at getting a supplemental plan because you're going to be out of your covered area quite a bit. And one thing about supplementals that if you do move from state to state or just move in general, it will follow you versus if you get an Advantage plan and say we're in 78744 and I move to 78748, I have to notify Social Security that I have relocated and then I have to apply for Medicare. Now, that's not saying if I'm on Humana doesn't have a plan to cover that area. They just have to transition me to the correct zip code.
Okay. Thank you.
So like when I moved my mom here, she came from Lufkin. She had Cigna Health Springs. They did not have Cigna in Austin. So she was going to have to get a new insurance anyway. But if Cigna would have been here, then they would have just had to make sure it was in her zip code area.
But because she moved and Cigna was not here.
Right. We had to get a whole new policy.
Okay. Can you use Medicare if you are out of the country?
If you're on vacation and something happens in an emergency, which I mentioned earlier, Medicare will cover the emergency. If you live, like I stated earlier, if you live in China 6 months, in the States 6 months, then you're gonna need to get a supplemental, because they're gonna be like, wait a minute, she was over there in January and went to the doctor, and here it is March, she's back at the doctor. They're not gonna cover it.
Okay. So we have a question. Does Medicare cover any home health care, or does it only cover hospital stays and skilled nursing?
So Medicare covers skilled, which is PT, occupational therapy, physical therapy, nursing. They will provide a home health aide to come in and assist you with bathing and maybe do a load of laundry, but that's it. If you're looking for a long-term care with personal care needs, such as cooking, cleaning, laundry, bathing, cooking, bathing, assisting with medications and things of that nature, the Department of Aging and Disability Services through Texas Health and Human Services has a program called Community Attendant Services. They are more long-term with the personal care needs. And again, you will have to meet the income and resource. It's based on your income and your resources.
Thank you. And if just for those who are familiar with Medicare covering the more medical OT, PT, and nurse side of home health care, it is something that needs to be renewed. So checking in with the doctor who has ordered the home health that is being covered through insurance and Medicare, just keep up with that, because it can be a surprise sometimes when you or your person is receiving this particular service through home health, and then it just ends.
Right, because usually like with the home health aid, they give you 120 days. That's it. Unless your doctor extends it.
Yes.
It's got to be something to extend it for.
Yes. So it's just good to touch base with your medical team or the individual who has ordered that for you, or right, for your care recipients. Let's see. I have Part A, B, and D. My question is, I have a private prescription plan already. So is there a benefit to have Part D?
So do you have Part A, B, and D as in an Advantage plan, or is it A, B, and a separate D plan?
That's a good question, and I hope the individual who posted that can answer. But in terms of that, so just to clarify this too, an individual who has like this person has Part A, B, and D, which is the drug coverage portion. Also, I'm assuming has a private prescription plan.
So if the private prescription plan is a creditable source, say, then she don't have to have Part D.
Okay.
But if it's not, if it's like a RX, a good RX or something like that, that's not going to do it.
Okay.
Medicare will not accept that.
It sounds like it's an Advantage plan.
Okay, so if she has an Advantage plan, it's bundled regardless. It's included in that plan.
Okay. Specifically, they have Express Scripts.
If it's something that's purchased or given like HEB or Walgreens or something that's an entity from somewhere else outside of Medicare, she may be not in a good place. Keep the Part D. If the Part D will keep her from occurring those penalties, and she can use that on the side if it's cheaper. Because some people will get a prescription and they still, like I would tell them, my prescription costs, I take this acid reflux medicine, it's $4. So if I had to get on Medicare and it's $6, I'm gonna continue to use the Walmart that's $4. But I will still keep the Part D because that's gonna keep me from having those penalties.
That's right. Thank you. So let's see. So it looks like, and I don't know if you can touch on this, it looks like we have a couple of Medicaid questions. So earlier we talked about if somebody applies for Medicaid in a different state, that they need to stop their benefits within the state that they are currently in and receiving benefits in before they apply in the new state. Is there, how does that work with that, if you know the gap of coverage? So we have an individual who stops their insurance, their Medicaid insurance and benefits here in the state of Texas, but they're moving to Florida.
Yeah, so what happens is you generally, so say they move now, they're there. So their Medicaid will run out here in October the 31st. They'll shut it down. So then you apply in Florida, and I don't know how long it takes in Florida. I don't know if it takes 45 days, 30 days. I always tell people to get with that area and see before they close anything, because sometimes Texas is just different. Sometimes they may be like, okay, hold on, give me your information. We can transfer it over. It may take 15 days, 10 working days. Everybody is different. So when you do the transition, it may be where she just be up under traditional. So for instance, if they have Medicaid Star Plus, they have to shut the Star Plus down here and then apply over there. It may not even be open over there because we have a waiting list here. So if you have Medicaid in Oklahoma and you come here, you got to wait till you come off the interest list here to get the Star Plus. What's equivalent to Star Plus here to Oklahoma. So you're going to be without that and have to make the decision to get an Advantage plan or a supplemental plan or ride it out with just traditional Medicare.
Okay.
So if you get Medicaid that helps with the 148.50, you may be responsible for that 148.50 until it kicks in another state. But SLMB and QI1, they will retro back and give you your money back.
Okay.
QMB does not.
Okay. And we actually have a QMB question. It says, my mother currently has QMB. Now she's been diagnosed with Alzheimer's. Should she apply for traditional Medicaid in order to get help with long-term care down the road? Are QMB and Medicaid not compatible?
They are compatible, and because she's already on QMB, if something happens down the road where you have to place her in a facility, and I'm gonna just say this, guys, you get some good information from me because all the benefits counselors don't know about Medicaid. I worked for DAS for 15 years, so you're getting bonus, okay?
Thank you.
Because if somebody else was doing it, they'll say, you have to call 211 or call blah, 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 blah. So high five.
No, we appreciate it. It's very,
so
both programs can get confusing.
no, the QMB is considered, is full Medicaid. It's Medicaid funded. It pays for the co-pays, deductibles, out-of-pocket costs. So if she happens to have to go into a facility down the road or need some assistance, the QMB will cover that. So what they'll do is they'll transition it to nursing home Medicaid. You will just have to find a facility that accepts Medicaid. So no, leave her on the QMB. If you're needing assistance in the home with her, reach out to DADS, the Department of Aging and Disability Services. Reach out to them to get the community attendance services or the primary PHC, primary home services. No, primary home care. Y'all making me dig out my dad days. Yeah, primary home care, and those will be long-term services for that. So my mom has dementia. So what I done when she first came here is I applied for DADS and got her the community attendance services. Then I put her on the Star Plus waiver program. And then once she came off the waiting list, she's on the Star Plus waiver program, which is full Medicaid. So those of you whose parents are dealing, or you're dealing with parents with dementia, go ahead and call DADS. And I have the number for you. If you want to put it in for them, it's 1-855-839-3237. Ask them for the Star Plus waiver program. They will put you on an interest list. They will send you information letting you know that, hey, you have been placed on this list. And then the wait for it, as I was told a couple of months ago, is a 6 month to 1 year wait. Once you come off that list, they will come out and do an assessment where we done it via Zoom because of COVID. And then they'll submit the information to her doctor. You want to make sure it gets to the doctor that's going to know her case as far as the dementia, her cognitive state. And then once he approves it, it starts up. And then with that, you do get the care, and then you get DME equipment, you can get a life alert button, you can get so many different things that they may need, a shower chair, a wand, briefs, Glucerna, just wealth of resources with that program.
And what was that 855 number again?
It's 1-855-839-3237. And this is the DADS intake line, and DADS is Department of Aging and Disability Services. I know we use a lot of acronyms, but we can't help it. There's somebody say, what they mean? Hold on.
Yes, thank you.
You're welcome.
All right. Oh, let me go ahead and put that in the chat for everyone. And this will also be sent out to everyone in a follow-up email, which will include resources both on Medicare and Medicaid that I hope you find helpful. Let's see. There we go.
So I see one, so I'm scrolling through the chat too, guys. So I see one, something that has a ladybird provision, not sure how it actually, what it's actually called in Medicare, when patients end up exhausting their finances to spend on treatment and cannot qualify for Medicaid because of home ownership. Could explain this. So if you own, you are allowed to have a homestead. It's when you have additional properties, rental properties, stocks, bonds, annuities, because Medicaid cuts you off at $2,000 as a single person, $4,000 as a couple. The ladybird only protects the assets if you go into the nursing home. If you want to, if you have money, you have to figure out, look into a Miller's Trust. So, and the Ladybird Act has been replaced with the TOD, which is a transfer on death deed. So for instance, I'm going to use my mom. She has property back home. We have a homestead and she has additional property. I put a TOD on the property because she is in a Medicaid, she's on a Medicaid service. So once she passes away, Medicaid can, not will, but they can come back and file a claim on her estate to recoup payment for what they paid out while she was on this program. There's some more nuggets that only I know. So the reason why when you sign up for community attended services, it's under that umbrella of the MERP, which is the Medicaid Estate Recovery Program. MERP is the thing that they have filed a claim on the state to recoup back the monies that they paid out on the program. If you get the TOD or the Ladybird, it protects those assets. So I got her a TOD. So if she does have to go in a facility due to her dementia, her assets are protected. So they definitely come back and recoup monies if you're in a nursing facility. We have not known them to come back and recoup money if you are receiving community attended services. Community attended services is under that umbrella because it is paid for out of the same pot. When I say pot, same money, same funding.
Thank you. There's another question here. It says for the Medicaid Star Plus, you have to be on Medicare though, correct?
No, you could be Medicare or Medicaid. Generally, because Star Plus is Medicaid funded, And generally, when you apply for Star Plus, you usually don't qualify for traditional Medicaid.
Okay. So this individual says most people with frontotemporal degeneration, which is a type of dementia, are under 65. This individual facilitates a support group for those caring for the individuals. And how does that work if it's if the individuals who are living with the dementia are under 65, and could this be a situation where they can be on a Medicaid Star Plus program, but due to the dementia diagnosis, are they able to access Medicare at an earlier age? Or
Oh, yeah, if they're so if somebody under 65 gets dementia, then they're disabled. That's a disability. So if they have worked and put in their quarters, they can file for disability through Social Security. And then, of course, they will become Medicare eligible within 2 years. During that process, you could go ahead, because they are disabled and receiving Social Security, they just have not received Medicare. So you can apply for Medicaid, or you can apply for Star Plus, depending on the income. Now, if the income is up there, don't apply for traditional Medicaid because they're not going to qualify. Go ahead and put them on the waiting list for the Star Plus waiver.
okay, thank you. Let's see.
So
here's a-
I see, is long-term care insurance considered an asset? No. Unless you can get money off of that policy, then it's not an asset.
Okay. I think those are all the questions that we have so far. If you are currently on the call and have another question, please drop it in the chat box. This has been really informative. Thank you. I'm so glad that you do have all this knowledge of Medicaid too.
Yes, when I first came here, I was like, Medicaid. I was like, no, Medicare. I had to get it out of my head. But 15 years, y'all, 15 years. So I still have to follow up sometime, like, are y'all still doing that? But nothing has really changed when it comes to as far as the resources. Medicaid, the resources are really, you have to be really, really low. What I do advise is to go ahead and start moving money around, putting it where with someone you can trust. That was one of the issues I had with my mom. I kept telling her, as soon as I started working for Medicaid, I was like, you need to start doing certain things so you can prepare for when you do get older. And she did not do those things. But once she had, yes, a Medicaid spend down. So once, and they will allow you to do that. But if you don't want to spend it down at this time, move it. They only look for what you put down. I can't say too much because we're recorded.
And there are, just for everyone, there are elder law attorneys too in our community that can assist with this, so that obviously you are doing this the right way.
Right.
And yes, of course, there is a look back period, but there are ways to legally do this. And so,
like I said, the Miller's Trust is a good resource. Like, talk to your estate planner. Just my thing is, talk to your estate planner and look into the Miller's Trust if you can't do anything quickly, because they'll look back, they go back 3 months. Now with properties and assets being transferred, they go back 5 years. But as far as the money, they go back 3 months.
Yeah, so an elder law attorney, an estate planner, a lot of elder law attorneys here in our area are connected to financial advisors as well. So they, they make sure that everything is being taken care of the way it should be. Obviously that this is a process. Everything in terms of accessing services, there is a process that goes along with it. So take a deep breath. But start it, even if it's, a slower process. Maybe you're not in the immediate need in the moment to need to access this type of service. So just, I encourage you to start any processes that you can, and just know that, sometimes it does take a little time, but it is absolutely worth it.
It is. And I mean, you look at it now, I had my mama plan like I told her to. The decisions that's being made would be her decisions. Now they are mine, which I make pretty good decisions, but you always want to be in control of your care. So,
and that's a great point. And thank you for mentioning that, because as several of you on the chat have mentioned, you are caring for an individual living with dementia. And it can get really tricky once you get down the road when it comes to all the paperwork, and just making sure that you have all the documents in order that are needed before that individual is unable to sign those documents or make decisions related to their care. It's always really important to include that individual in their care planning.
right. So we had one more question, and it was, it moved. Okay. Are there any Medicare benefits that your clients may not know about? No, Medicare, you can, another resource to go to is Medicare.gov. You can go to Medicare.gov, create you a username or password, or you can just log in without continuing, and it'll give you the advantage plans in your area. It will allow you to compare up the 3 plans, so you can look at, you put your prescriptions in, it'll give you the cost of the plans, it'll give you your co-pays, your deductibles, any co-insurances, all of that. So that'll have you familiar. But the only thing that we have to offer as far as Medicare benefits is the Medicare Savings Program and the Extra Help and Low Income Subsidy. And like I said, that is income and resource. It goes off your income and resources that help pays any out-of-pocket costs as far as the Part B premium and your prescription costs. Because the low income subsidy and extra help, it pays for the Part B premium and your prescription costs. It gives you discounts on those things. And it could be anywhere from you pay 0 to a certain percentage. It just depends on your income.
So we have a couple more questions. Thank you for that. So one of them I want to touch on real quick, and then I'll hand this other one over to you. Is someone asked, will someone be available to talk one-on-one when a need arises for Medicaid filing? So I'll touch on this just a little bit too, and you can jump in, Eva,
Okay.
if you have additional information. There is a community partner program that has sites all around the area. These are organizations that are part of this large program that can help with applying for Medicaid. They can help you with the application. They are not eligibility specialists, but they can help you walk through the application process, which is incredibly helpful in making sure that you're checking off all the correct boxes, that you understand the language that is being used. They can help you with the application process. This particular resource, the website, once you go to the website, and this will be included in the follow-up email, because I think it's really helpful. Once you go to the website, you can type in your, excuse me, your zip code, and then it will generate a list of nearby locations. And those, again, are locations that you can call to help with application assistance. So there is someone to help with that. Typically, and please correct, or add to this, Yvette, typically for eligibility questions or application status questions, you are directed to 211, correct?
Unfortunately,
when it comes to Medicaid.
Yes. Look, unfortunately, yes. So it's best to go ahead, if you're going to apply for Medicaid, to go ahead and create your Texas benefits website and create a username and password, and that will help you also. You can go in and check in it, and it'll give you updates. It'll let you know if it's in process or if they're reviewing, if they're requesting additional information. The main thing when you apply for Medicaid is to make sure you send in all your documentations. Anything you have, they want to know proof of it and verification of it. So if you have a car and it's a 2000 Toyota, they want to know what the Kelly Blue Book value is. They're going to want to know what your insurance policies are, life and burial. If you have a plot, they want to know that. So just make sure anything that you put down, you can verify and have that information when you send it in. And always, always, always keep a copy. Because they'll say, oh, we didn't receive it, or we didn't get it, or da, da, da. No, always keep a spare. Always.
I've also heard that when applying for Medicaid, that sometimes there are families who are maybe, in the moment not interested in particular or applying for particular items or benefits. And so they skip over that. And I've heard that it's best to just apply for as much as you can, because it's much easier to just be denied rather than go back and reapply for benefits that you could have maybe, received or been approved for in the beginning, like during that first application process.
I agree. Yeah, go ahead and apply for everything. And that's what happens. Sometimes people will fill out the application and they was like, well, I didn't apply for Medicaid, but they said I was denied because they knew they couldn't apply. But sometimes that form, it's a long form, is used for many programs.
And I will also add that, I don't know if I mentioned this, but the community partner program I mentioned that has application assistance sites all over the Austin area, that's at no cost to you. This is free application assistance. So that's, I just want to put that out there because it is accessible to everyone. And so I just wanted to make sure that is.
And another thing too, if y'all are wanting to talk to a benefits counselor, feel free to reach out to us. My number is 512-916-6178. That is our BC line. You can just call and leave a message and say, I want to look at some plans, or I want to follow up with some information, and we'll be glad to assist you. We also have a BC info line where you can email us, and it's bcinfo@capcog.org. So that's a free service for you guys. We also have other services. We have short-term caregiver support. We have respite. We can help with utilities. I'm not sure if we're still doing rental assistance, but we can help with some hearing aids, some DME equipment. We're just a wealth of resources. So feel free to reach out. And if you have questions about something, you can email, say, hey, Vet, I was on the Zoom. You said y'all had these resources, and I can respond back and say, yeah, we can help you, or no, we can't help you, but someone else can.
But real quick, before we wrap up, thank you for mentioning that. You all are incredible. The Area Agency on Aging is incredible. And Age of Central Texas can help submit referrals to their programs. So, and we can also talk about, their programs and other programs in the area, and submit referrals on your behalf. I have one question. It says, can you repeat again what to do if your income is above Medicaid levels and you own a home? What are reliable resources that are available?
So when you say, okay, everybody that receives Social Security 9 times out of 10 will not be approved for traditional Medicaid. Medicaid allows you to have one home. If you have additional rental properties or resources like that, you're going to be over-resourced. So you're not going to be able to qualify for a Medicaid program. If you have additional monies, you may want to look into a Miller's Trust. Oh, I think they call it Miller's Trust or QTI or QIT. It has two different names. But that's something you may want to look into. But again, you would have to discuss that with a lawyer and they can tell you how to set that up. But once you put that money in the Miller's Trust, it kind of hides it. Not for you to save it, but it allows you to be approved for Medicaid, but you still have to utilize those funds toward your care. But a lawyer could kind of assist you with the trust and break it down for you. I'm just kind of giving you what I know. So don't quote me. Things might be done changed on that one.
What is the benefits counseling line again?
It's a 512-916-6178.
Perfect. And this will also, everyone, I don't want you to feel like you have to scramble to write all of this down or.
And I will say for the home care, Medicaid, you can make $23.79 for the community attendance services, but your resources can't be over $2,000. So that may be the catch right there.
Okay. Wonderful. Thank you so much. I appreciate you, and I'm sure everyone else on the call appreciates this knowledge that you are, sharing with us. Again, these programs can be so confusing and overwhelming, especially for individuals who are coming up on, deadlines or have now, fallen into the caregiving role. So thank you again so much for being with us.
You're welcome. And thank you guys for having me. So feel free to reach out to either one of us. And like I say, we have a wealth of information and a wealth of resources. I always tell my daughter, utilize your resources. Now I'm telling you guys, utilize your resources.
Yes. And again, everyone, we will be sending out a follow-up email with a recording and all of the resources that we have discussed today. And so just keep an eye out for that and let us know if you need anything or have any other questions.
All right, guys.
Thank you.
Have a good day. Thank you.
You too. Bye-bye, everyone.